Hello, and welcome to another episode of St. Jude in 5-ish. Our guest today is Dr. Alistair Aronson, Medical Director of Utilization Management. Dr. Aronson joined St. Jude last year after spending 4 years at Stanford University Medical Center as a board-certified hospitalist with additional responsibilities for process and quality improvements. Thank you for being here today.
Great, thank you.
So, after a year at St. Jude, what do you think?
It's been remarkable. The culture here is unbelievable. The people are great to work with. The patients are phenomenal. The priority is always on patient care and providing the best quality, and it makes me very proud.
Oh, excellent. Well, we're glad to have you. What exactly is utilization management?
All right, I get that question a lot. It's a little bit confusing. No one's quite sure exactly what it means,
Right.
but essentially it is high-value care. So we all know what high value means. It's essentially providing high quality at an affordable cost. So what I really focus on is trying to make sure that our patients at St. Jude receive the highest quality care at the most affordable cost to them.
Okay. And how do you do that exactly?
So it's a collaborative effort. I don't do it individually. I work with a lot of great people, so physician colleagues, nurses, physical therapists, leadership, frontline staff. Everybody works together to really focus on providing the best quality care to our patients.
Okay. Very good. And so can you describe for me a little bit about the difference between low-value care and high-value care in more
Absolutely.
detail?
So low-value care is providing medical care to patients that is not needed and potentially harmful, not evidence-based, and poor quality with adverse outcomes. These include doing CT tests that aren't needed, which can subject patients to unneeded radiation, lab tests, procedures which can be harmful and have their own risks. That's low-value care. High-value care, on the other hand, is making sure that every procedure, every test done to a patient, for a patient, is in the best evidence and provides the best quality care to them and doesn't subject them to unneeded risks and harms.
So we throw that term out a lot, evidence-based medicine. Can you kind of dive a little bit more into that? What exactly does that mean, and why is it important?
Absolutely. So there was a time when the best evidence in medicine was to put leeches on the body to suck out the blood to release the evil spirits that cause illness. At that time, that's all people really knew, and that's what the medical treatments were. Now we realize that's not quite how the body works and not quite how illness works, and it's not quite the best treatment. So evidence-based medicine is essentially using the latest research put out by the researchers and physicians who do this kind of research in different fields, and really using that research to guide our behaviors for how we take care of our patients. And that is providing high-value care because the best evidence, the latest guidelines is what should drive our behavior in healthcare.
Right, very good. Now, what other initiatives do we have that improve the value of our care, specifically at St. Jude?
So we have multiple initiatives going on at any given time, and they're all under the umbrella of providing high-value care to our patients. And one major project is our Telemetry project. So Telemetry is essentially 24-hour monitoring of the heart rhythm with a box on a patient being monitored 24/7 by a professional. And this seems like a very benign thing, and that everyone should be on it just because it's like getting a full-body MRI. Why not just find out what's going on? But this has inherent problem, right? So if you have 24/7 monitoring of a heart rhythm, you may find something that you act upon, do a procedure on that isn't needed, right? Something asymptomatic. It's uncomfortable for a patient to have a box on, alarms going off. It's uncomfortable and potentially dangerous to have alarms going off that then the nurses become numb to and have alarm fatigue. So you really only want to use a sophisticated technology when it's really needed and evidence-based. And we're lucky that for the past 15 years, the American College of Cardiology has had some guidelines to really guide how we use telemetry and what kind of patients benefit from that technology. So at St. Jude, we've been utilizing those guidelines to kind of drive the best evidence behavior for how we really focus on the patients who need that monitoring and don't subject patients to the burden of having that monitoring if they don't really need it.
And what about the outcomes? Have you seen improvements in the outcomes as well?
Absolutely. So we're not just tracking the amount of telemetry usage, but we really want to focus on the appropriate telemetry usage. So we've been tracking that. And we've been doing a great job with our nurses, with our physicians, everyone who's involved in this project. And we have seen tremendous improvements in appropriate use of telemetry.
Very good.
Yeah.
So caregivers, we all have a role to play, obviously, in keeping these costs down. So what are some of the things that we as individuals and as a professional collaborative team, what can we do to help make a difference in improving that value?
I think the biggest thing we can all do together is always think and question, is this really in the best interest of our patients? Is this really the best evidence we're providing when we deliver our care to our patients? And if we always have that inquisitive mind as to, does this behavior really help? Or is it just needed and wasteful and potentially harmful? So that inquisitive mind, I think, will benefit all of us and benefit our patients.
So critical thinking is key.
Absolutely.
All right, now looking ahead, what improvements or changes over the next few years do you see having the biggest impact on elevating value?
So there are many potential opportunities. So the first thing is to look what at St. Jude are we offering to our patients that may not be the most evidence-based. So some things we're going to be working on in the future are CT scans. These are potentially harmful because they subject patients to radiation. And we want to make sure that CT scans we give our patients are really evidence-based and really are beneficial for those patients. So head CTs for certain diagnoses, abdominal CTs for certain diagnoses. We want to make sure that the patients who receive these tests actually need them.
Very good. Now, my last question
Yes.
is a more personal question. And so let's talk about the last time that you went dancing.
All right, all right.
Do you remember when that was, where that was, and who it was with?
I do actually. Funny you should ask. So I got married 2 months ago, and that was the last time I danced, and it was unrehearsed. We wanted to be ad-lib,
Yeah.
so it was with my wife.
And what style of dance was it?
It was impromptu. It was meant to be a more formal dance,
More
but it
formal.
ended up being impromptu. But I think that's the best.
Yes, I agree. And congratulations also
Thank
on
you.
your wedding. Well, thank you for joining me today, Dr. Aronson. And thank you for tuning into St. Jude and 5-ish. On behalf of Public Affairs, we wish you a very happy, healthy, and safe holiday season. We'll see you next time.